You know, the reason for the town hall, we've had Don, Jennifer, myself, and a number of board members have received emails and phone calls regarding the COVID-19 virus and its effects on our camp. So on the next slide, these are the 5 biggest topics that have come up from those phone calls and emails. So, our camp scheduling and operations, year-round programming, volunteering, or volunteers, excuse me, fundraising has been an issue, and then alternate delivery of programs, whether it be camp in a box or virtual camps, etc. So that's kind of where we're going with today's town hall, and the topics that we're going to cover. So what is a town hall? Well, right now, let's be honest, it's your town hall, it's your agenda. We do have a base agenda, but it is very fluid. So, we'll spend as much a little time as we need to on different topics, depending on what the group feels and the questions that are asked and concerns that are had. But it's all about your input, because it's all about you and your camp and your campers. I can tell you what it's not. It's definitely not an in-depth conversation about what the virus is itself. We know what the effects of the virus have on us physically, but we want to talk about the effects the virus has on our camps. So we will be focusing more on that than the actual virus itself. It's not a lecture. You're not going to hear me as much. Hopefully I'll just be able to guide the conversation, talk about the topics and the slides. But other than that, it's definitely really all about your input and what you have to say about the given topics and the questions that you have. So we're going to just dive right in. A couple of things as more of functional is if y'all don't mind staying on mute as much as possible. This way we can, bring down any background noise that is had, and then obviously unmute when you need to ask a question or say something. We do have the chat function on the side. Jennifer is monitoring our chat function. So if there's a question that is posed, in the last room, someone's mic didn't work, but they were able to put their question in the chat. We will make sure anything that goes in the chat gets answered or asked and hopefully answered. So please feel free to use that function. And then also, if you can just introduce yourself when you go to speak, this way when Ryan is taking notes or if anyone has follow-up, we can identify who's actually speaking and from what camp. So we'll be able to reach out to them and ask those questions. So if all is good to go, we're going to start right away and talk about our camp scheduling and operations. So you'll see between each topic, 2 charts, and these charts came directly from the pre-town hall survey. Again, you'll get copies of all of this, but the pie graph talks about current state and local restrictions that your camp may be facing as far as operations. So, max number of people at an event or school closures, what have you. And the other chart, the bar graph, talks about if you had to cancel events already. So April, May, and June are the colors that are represented. There are none listed right now as far as those who took the survey, that they've had to cancel summer plans. A lot of the camps that responded to the survey that run their camp in August are really and truthfully in a wait and see hold right now. So obviously they haven't had a need to cancel yet. So talking about camp scheduling and operations, love to put out a topic for y'all to talk about. Have you had to reschedule or cancel your camp? It doesn't necessarily also have to be about your specific camp. It could be if you run a siblings weekend or a parent family camp, any type of programming if you've had to cancel or reschedule. And what was the criteria that went into that? What did you look towards for guidance? And then if you are planning to reschedule, are there any facility concerns if you don't own your own camp and that type of stuff? So I'm curious to hear from everybody what's going on with your camp scheduling process. So anyone at all who wants to jump in, please feel free to unmute and ask your questions. Tell us what's going on with your camp.
Hi everyone, Larry with Periwinkle, Houston, and we ended up canceling our spring program, our spring camp programs, a teen camp and a family camp, um, as well as other events throughout the basically all the hospital events with our arts and creative writing program have been canceled until further notice. We are not rescheduling our camp events because we typically do those twice a year. So they'll just resume in the fall as normal. Um, but we basically look to Texas Children's on their recommendations, and the infectious controls kind of said, yeah, you guys should go ahead and cancel. So we have a camp coming up in June. We are waiting to hear from recommendations from Texas Children's, and then we also have a camp in beginning of August. So we're again still just waiting and seeing what all of this does and what other camps are doing as well.
Thanks, Larry.
This is Crystal Davison with Camp Quality. And there's several camp qualities across the nation. As part of our region, we had a sibling event and a family weekend coming up that we had to cancel in April and May. And then we're having a directors conference call next Tuesday. And ultimately, we've had some guidelines passed down already, but decisions are going to be made much sooner. I anticipate that any of our June camps are going to be out of luck. And guidelines are being based on CDC recommendations as well as local, state, and even county health department regulations. And we're following whichever is more stringent. And here locally, we're recommendations as far as whether it's safe and what that looks like, considering things like insurance and if cases are covered with our insurance, how we're going to screen volunteers and kids, since some of these cases are asymptomatic, etc. So still.
This is Chris from Camp Hobie. We had planned when I did the survey, we were planning that we would let our families know in May what we were going to do. My planning team, I have a core group of 2 board members and my medical director and another staff person with myself have been working on, we have a mini task force that have been working on this. We had a discussion this week after seeing our rates going up here in Utah, and we have decided that we are not going to offer a live camp this summer. Our camp was supposed to be in June. We know that our campsite is closed through May because of the health department, and that's for normal people that don't have cancer. So working with our medical director and primary, we've decided we're going to go virtual this year. And rather than wait, we wanted to give our staff the opportunity to have 2 months to plan a rainy day camp that's virtual. Our board actually just voted on it Wednesday night, so this is all very new. We haven't messaged that out to the rest of our staff yet. We're working on that so we can do it in a thoughtful and kind way to them next week, and then start letting our volunteer applicants and campers know that we're making that change. And it wasn't an easy decision, but we feel like this is the best thing. We don't want to give people false hope by saying we're going to wait or by saying we're going to postpone. And I'm not saying that having hope is bad, just in our minds, what's going on locally, we felt like the better call for us and for our organization was to make a decision now and control it where we can.
This is Deb from Camp I Hope in Texas. We have been monitoring the situation as well. We rent our facility, and we secured an additional week, the second week of August, which is a little bit problematic because a lot of our schools go back in session then. So we're still looking at what are some other things that we can do. We did message to our families that we would let them know in April, depending on how the situation progressed. I think for the medical team, our gut feeling is that we're going to be canceling, but we haven't pulled the trigger on that yet. I have listened to a couple of other, there was a call with the Camp Nursing Association and Camp Doc, and they sounded a bit more hopeful that camps would happen, but they did do a lot of talking about how do we change our structure, because we're going to be really, even when we get past this is going to be something we'll be living with and need to screen for in the future. So that's kind of where we're at.
I think, Brandon, I think your mic is not on. I see your mouth moving, but no sound.
Yeah, me too. Although his mic is green.
That's me. Okay.
Oh.
Yeah, this is Joey Cavazos. And we are going to make a decision by mid-June because our camp's at the end of July or mid-July. I've sent an email out to families saying that as far as we're concerned, we're going to keep on going forward, but we're not going to take any risks medically. So we're not going to be foolish about it. But we're not going to pull the plug this early.
Oh.
We've had to cancel one family camp and 2 hospital camps so far. So.
Oh, wow. Is somebody playing music?
Brandon,
Are we on hold maybe? Could we be on hold and getting your background music?
I can't hear Brandon either, so.
Yeah. While he's working on that, though, are there any other camps on the call that have either decided to move from an on-site to a virtual, or or are in that sit and wait? I know us at Camp Happy Times, our camp's not until the 3rd week of August, so we're not. Right now, we're just moving forward as if we're going to have camp. So we're going to wait and see. We do have a cutoff date. We're looking at like July 1st, between July 1st, July 5th, to make a decision based on, what the CDC and our partnering hospitals are saying. But right now we're definitely in a hold as far as that.
Matt, we're kind of at the mercy of our host camp,
right?
Because over half their staff are international. So I don't even know if they're going to be able to trust camps or not. So we don't know.
Yep. Yeah,
we have sorry, Matt. We have international staff, and we run our facility as well. And basically, Camp America has already told us that they might be able to come if they already have their visas in their hand, but that there's no way they'll be able to come if they don't have their visas yet. So I would put it at like a 30% chance that we're going to be able to get international staff here.
Mm. Yeah, that's something that we have to be concerned about too. Just the site that we rent, they do the same thing. They have a great deal of international staff. I bring in all the cabin staff and some specialty, but yeah, the remainder of the folks who work the kitchen and the pool, those guys are all the other staff.
Can I?
True concern.
Sorry, I know I said something already, and I was the first person, and I'm like, nope, we're not. But just one thing that we really considered is that with this happening, we're going to have a very hard time getting medical staff for our camp. We've already had volunteer applicants contact us in the last couple weeks. medical staff and regular staff and say that they don't have PTO or they don't have jobs. And we're anticipating the crunch on med staff to get worse here as our surge ramps up. And also just, I did a message on the chat, but I know some of you know some people from my camp. Please do not say anything to them. I have not told all my staff yet. Thank you.
Can you guys hear me now?
Yes, Brandon.
Yeah.
Okay. I switched to a tablet. I don't know why it wasn't working on the laptop because that's what I used last night and it worked fine. So I was just going to say that during our spring break camp, we decided to go ahead and finish spring break camp, but that's when, you know, everything was really hitting the fan, and we decided anybody who was there was already exposed, so we finished out spring break camp, but did cancel the rest of our programs for March, April, and beginning of May, and I just got off of a board meeting call with our camp board, and we have set deadlines at May 1st. We will make a decision if we think we can have camp in June or not. And on June 1st, if we weren't able to start camp in June, on May 1st, we will decide. Sorry, on June 1st, we will decide if we will start camp in July, essentially. We already decided that we will not hold any of our sessions for more medically fragile campers, which are the ones that typically our kids with cancer would come to, knowing that that whole medically fragile population is much more vulnerable to anything. So we did decide to go ahead and cancel those for sure. We may still, for any long-term survivors who are off treatment and that sort of thing, may have other options for them to participate if we're able to do, able to do some version of summer camp, but we're just kind of in the wait and see mode right now and trying to gather the best information that we can as of May 1st to make that first decision, as of June 1st to make the next decision, and are hoping that we'll be able to go back to regular fall programming as we typically would, and be able to hold our family retreat with Joey for Camp Common Ground. Hope that, you know, the family retreat that we were supposed to hold this weekend can be rescheduled for the fall. But we're really just in that wait and see stage.
This is Fallon with Camp Quality Texas, and just to reiterate what Crystal said, like as Camp Quality as a whole, we're kind of looking at our individual camps, and so I spoke to my camp directors, and we're going to have a COC call next week, but we're looking at, you know, our medical staff. They probably, like Camp Hobie said, won't have time off, won't have any PTO, or have lost their jobs. And we're looking at the fact that some of our volunteers who are college students who've not been able to go to class or are having to postpone their graduation or what have you, and kind of seeing the full picture of, we may not have enough volunteers to run the camp, or we can't ensure that the camp is sanitized because we don't own it, we rent it. So we're going to make a call probably with the support of Patty. We're going to make a call probably the first week of April for Texas itself, and it's probably looking like we're going to do a rainy day camp as well, unfortunately. But we didn't want to spend the funds to plan program, and then in July we can't go to camp. So it was a multi-faceted decision on our part.
So let me pose a question there. There's a question on the chat, but it also, follows into the whole idea of have we accessed the availability of our volunteers and our paid staff and medical staff? But are folks seeing that are concerned about medical staff? Is it heme-onc medical staff and or general peds staff? Because every camp is different. Some have the heme-onc and some have general peds. So within that question, and also thinking about the accessibility or the availability, excuse me, of our volunteers and of our families. Has anyone heard from their families? Is there any concerns out there in regards to them attending camp?
Yeah, this is Joey. Our registration is down probably 15% from where it was last year. But, after I sent the email out, we started slowly getting more people signing up for it. I think they were just kind of concerned of whether it's going to happen or not. So, if I get 140, 30 kids instead of 151 kids, that's sign of the times, but right now we got like 48 kids signed up, and we still got several months to go. So I think everybody's just a little bit unsure about where they're going to be. Like everybody's saying, parents out of work and things like that. So I'm not going to push the issue too much and just take what we get.
Okay. So I'm sorry. Go ahead.
I was going to say, in terms of so far, most of our camper families, as well as volunteer and staff applicants, probably 90%, 95% or better, are not canceling yet, and are kind of saying, no, we're in if it can happen, and that goes for most of our healthcare volunteers. We often get some from Washington State, from the military base there, and those have already said they're not going to be able to. And so that's like 5 people. But again, we're running a full summer program, so we often have anywhere from 150 to 200 healthcare volunteers. So losing 5 isn't a huge impact for us at this point. Yesterday, I was on an ACA webinar about some of this, and Tracy Gaslin, Executive Director for the Association of Camp Nurses, predicted that general peds and like school nurses and those kind of folks will be available in the summer to summer camps, and she didn't think that there would be a huge impact. But for COCA camps that are looking for a more specialty kind of population, that could look very different, and she acknowledged that during the call as well.
Yeah, this is Deb from Camp I Hope, and we haven't had a problem with registration. I've had more concern with parents if we have to move to August with school and not being able to attend because of that. But that may change because we're due to hit our surge in Dallas next week. So I think depending on what they're seeing in the local media and how the cases play out in North Texas, that perception may change.
So you're gonna hear me say this a number of times, but please don't let the conversation just end just because we're switching gears and moving to another area. If you think of a question and you would like to ask it, please do. You can use the chat function, or obviously just ask the question. But moving on to thinking about, we're talking about our counselors and possibly their availability and that type of thing. From the survey, we asked 2 questions. If folks at camps were confident that you'd be able to recruit sufficient number of volunteers to run your camp based on last year's levels. That's the first chart, with the blue being yes. And the second chart, for those who answered the survey, this is, are they confident that they have the ability to recruit sufficient medical staff? And they also said yes in blue. So it's definitely, just a small piece of the membership that answered. So, moving on to the staffing piece and the staff recruitment, for those especially who are still, going forward with camp and with their programming, not just specific to their summer camp, but their other programming, how are you recruiting staff at this point? Are you changing your recruitments, methods? What about interviews? And some people may have been doing virtual interviews all along, and some folks are just switching it now to virtual. So we could talk about that. And as well as, how are you working your training, online training versus on-site training?
I hear the flamenco music again. It is not me, by the way, but I do like it. But I may have to find some to listen to later this afternoon. I can say that one of the things that we have been talking about, and we haven't developed a full plan of attack on this, and Matt, from your perspective, you may have some ideas for us, but we have not always had a lot of adult volunteers outside of professional healthcare volunteers. We've largely had college students and high school age volunteers for most of our programs. And we think that we're still going to get them to some extent, because regardless of what happens, they probably aren't going to have a lot of other opportunities available to them. But we've been talking about whether or not there is an opportunity to reach out to special education teachers and others who may not always want to spend time volunteering in the summer because they need that break. But since they're not having direct kid contact right now, we think that if restrictions are lifted and we're able to have summer camp, that some of those folks might have an interest in getting some kid time directly. And so we're trying to brainstorm how we can reach out to some of those folks to invite them to come as volunteers. One of the other things that ties into all of this that came through that ACA call yesterday is the very real possibility that even if restrictions are lifted and camps are able to do some version of camp this summer, there may still be strong recommendations for some social distancing. And that may mean that enrollment, if you normally enroll, 150 campers, that they're recommending you only enroll 75, and you sleep half the number of people in a cabin, so that there is more distance between beds and things like that, and that your activities look different, and you don't feed everybody in the dining hall at one time, because that puts people too close, that you don't have as many people in the pool at one time. So none of us know exactly what to expect, but these are some early predictions that are being made by camp health professionals, that may be considerations we have to keep in mind. And one of the other things that Tracy said yesterday that I think is also important for us all to begin considering is that coronavirus isn't going away. They're trying to flatten the curve right now, and hopefully we will get some vaccines that will help prevent it, or prevent its spread, or minimize symptoms, et cetera, before summer 2021. But like the traditional flu virus, cold virus, that sort of thing, it's out there, and we're not going to be able to eradicate it. And it may be that we have a new normal that we have to consider in terms of building in more social distancing, stronger sanitation, hand washing, those kinds of things into our programs for the long term. I would say that at least on the hand washing, sanitation side of things, that probably COCA camps are ahead of the curve on that, because they've been working with potentially immunosuppressed kids for so long that they're doing a lot of those good practices anyway. But it's just, again, potentially a new normal that all camps are going to have to adjust to. And I think it's good for us to start thinking along those lines now, even though we don't know what the full eventual guidance is going to be on it. So, yeah, not to be a Debbie Downer, but that may be the reality.
Whoever is designated caller number 2, I think the music is actually coming from your end. If you wouldn't mind trying to mute that, if possible, please. Thank you. So any other thoughts on staffing as far as recruitment, interviewing, training, etc.?
I don't want to dominate the conversation. The only other thing that I can add on training is that we also have started here talking about the kind of opportunity that being forced to think outside the box on things may provide for us. And while for years we've been talking about developing better online distance learning type of training opportunities, particularly when we have volunteers who want to come, but they're coming from other states. And traditionally, we have a week of pre-camp training for volunteers, or a shorter mini pre-camp training, but those don't happen right before each session. They happen twice in the summer. And so to get someone from California or New Jersey or wherever who wants to come volunteer, it either means that they have to come to Texas for a week of training, go back home, and then come back again later for their session, or we do some version of a makeup training, which is never as complete as we would want it to be. So, it's pushing us to think, are there ways that we can develop training videos, et cetera, in a much better way that won't only potentially be beneficial for us this summer, but could be beneficial in those other ways for years to come. We value the face-to-face in-person training, and we're definitely not talking about trying to eliminate that forever, but just with the current realities, it's pushing us to think about how we could do things a little more virtually this year, and there may be some long-term benefits from anything that we develop from that.
We actually had switched our volunteer interviews we usually do at the local ACS building, hosts us there, and that's also the building where the Hope Lodge is located. So they closed their building several weeks ago. We were in the middle of, we just had started our volunteer interviews, so we very quickly shifted to a virtual interview process earlier this month, and we've been doing that since. It has been a work in progress. We had everybody join on a Google Hangout, and we did our with their cameras on so we could see faces and people would feel like they were in the same room. I put my little Camp Hobie sign behind me in the office so that it had kind of a spirit. My staff worked remotely from their houses, and many of them also decorated their offices and tried to make it feel more fun and more festive. And that, it worked pretty well. Not everybody was able to have a camera on, so some people did have to use just a phone-in option. But we felt like during this time when, we're trying to do social distancing, we have a couple of counties on shelter in place, that was the best course to take. We had planned that we were going to shift our volunteer training to kind of a similar platform with Zoom or something so that we could do it online. We're going to rethink what we're doing with that, with the other parts changing. But that's been our experience.
We don't do our interviews until mid-April. It always conflicts with Fiesta. That's not a problem this year. So we're going to go ahead and stay the course. And, you know, it may be the safest bet may be that I just do them online or over the phone. Because most of the interviews that I have for new volunteers are from out of state or out of city anyway. So I only got like 3 within the city that would have to do face to face. So I might do all of them online or all of them a phone interview.
Yeah, we've been doing phone or Skype, Zoom, Hangouts, whatever interviews for a long time anyway. So it really hasn't been a change for us this year.
Yeah, this is Renee with Camp I Hope, and we do our interviews typically by phone. And so that won't change for us, and we are conducting interviews now. And then as far as our training, we've started last year to do a little bit more of it to try to get it done online and have them complete some tasks before they come to our training. And that's something we may be looking into a little more to expand that with everything that's going on. So those are kind of our plans right now.
This is Crystal. I can't get my microphone to stay on, but we've actually, for all of our new volunteers, we normally try to do a group interview, which we're not going to be able to do. So we're entertaining the idea of some of those virtual options. What we have done for some of our returning volunteers, and this is camp by camp based. Sorry, it's an online training through Expert Online Training with some videos that are already developed, like for camp people, and we have a committee that focuses on what videos we want to focus on for that year, and then we set up accounts for each of those volunteers. It includes some information too, like if your camp has their own kitchen staff or your own lifeguard staff, those different kinds of things. And we've been able to add in some extra, really like a quiz. Yeah. Okay, each of the videos offered through Expert Online Training has like a 10-question quiz that everybody has to complete afterwards. And then we don't have our own camp quality people doing a video, but we are able to add on a quiz that goes through our volunteer training manual. So there's some specific camp quality rules in there about 2 deep leadership and things like that we want them to know that they have to be able to answer those questions as well. So we may incorporate more of that and potentially some virtual options, assuming we're able to host.
So yeah, so I apologize that your mic had cut out again, but Jennifer did put the link in the chat function. And for those who don't have the chat function, you'll receive a copy of the chat box. So the website for Expert Online Training is there that you can, visit that website if you want to look into their training modules. And I know I've used them, not at my camp, but I volunteer at other camps, and other camps have used them. And, there's very different levels that you can choose from, certain videos for certain people, depending on the levels of your staff. So yeah, that's an opportunity for you to take a look at that expertonlinetraining.com. Right. Any other thoughts regarding staffing or staffing concerns? Okay, great. And yes, Chris mentioned on the chat function, Chris Thurber, who was one of the founders of the Expert Online Training, did a very good Facebook Live discussion earlier this week. Chris and I were both on it. He talked through a lot of virtual versus live considerations. So if you have an opportunity, his website, which I'll put up here as well, but it's drchristhurber.com. And also his Facebook page. Those videos are there, they're free. and there are some additional handouts that you can download and talk about how to have communication with your families during this time. And I actually use that that little discussion this week to send letters to my staff. I use the same ideas when writing to my staff. So it's a good opportunity. Thank you, Jennifer, for putting up the website. But if you have an opportunity to take a look at that, please do. It's a wealth of knowledge. But moving on to, there's a hot topic that a lot of camps have brought up to us leading up to these town halls, and that has to do with fundraising. So we're going to switch gears to talk a little bit about this. Two charts for you to take a look at. Has fundraising been affected by the current restrictions? More than 50% said yes. And the other chart is how likely, with the lack of funds, would you be able to have camp? And 72% believe that it won't be an issue, that they could have camp without the funding. But there's still that 24% that are unsure, and 4% that unfortunately are saying yes, without that funding, they won't be able to hold camp this year. So we're going to talk a little bit about fundraising. If anyone has any ideas, whether or not you had to reschedule or outright cancel your fundraising events, if anyone is thinking of some, out of the box ways of fundraising, but also what are you doing to acknowledge your donors and sponsors that you've had for years? Are there any other special appeals that you're doing, or any stewardship? So we do want to talk about that. That's on the next slide, and see what your thoughts are on fundraising.
We ended up canceling our gala, which we do every other year. Scheduled for. I'm sorry, we didn't cancel. We rescheduled it. So it was supposed to take place early April, and we rescheduled it for October 2nd, I believe. And we had some third-party events that we've had to cancel. We're going to try to reschedule those.
Hi, this is Margie Scher from Heart of Passion. I think with regards to rescheduling and canceling fundraising, one of the things the board and I have talked a lot about is the pros and cons of using third-party websites like GoFundMe or Kickstarter. We understand that there are some fees involved, but at this point, we're sort of considering that as a cost of doing business as compared to canceling an event altogether. I also think that while people are on social media a little bit more than usual during this time, we're hoping that they'll get some extra traction, or we can hop on to some of those viral trends that are going on to really raise awareness about our virtual fundraising efforts.
We definitely have had some things that have had to be put on hold or postponed until the fall. San Antonio's Big Day of Giving, which I know Joey would know about this too. Big Give was supposed to have been yesterday, and they postponed it until September so that they could use that platform more for emergency response to COVID. For us, that means that they rescheduled it 2 days before our gala was scheduled. So now we have to think about, do we reschedule our gala as well? But we're also talking about whether or not we should look at a very different type of event than our traditional gala. With everybody emerging from this crisis, we have some concern that sort of potentially frivolous seeming event that people dress up and spend money on clothes and a new purse and new shoes and whatever isn't the best use of limited funds that people have, and whether that means doing a sort of virtual no-show gala or doing something more at camp that is a lot more casual. We're just exploring different potential options, and also trying to think about the things that are most important. Excuse me. The things that are most important to us to maintain, and one of our greatest priorities right now is to be able to retain all of our full-time staff throughout the year, even if summer camp can't happen, since a good amount of our revenue comes in because of summer camp, either through reimbursement from Medicaid waiver programs or whatever. We're looking at how we stay afloat and keep people employed. The government stimulus package that looks like it's in the pipeline may be helpful to many of our nonprofit organizations, but there's a lot that's up in the air that overlaps. The other thing that we've done on the flip side of that is that we went into a spending freeze, and anything that is considered non-essential right now, we're just not doing it. There are things that we're continuing to do to try to get camp ready for summer camp, should we be able to have it, but we're trying to prioritize projects that we already have the materials for, that we can use our existing labor force to accomplish, and any of the things that require more investment of supplies, materials, etc., we're postponing until closer to knowing whether camp is actually going to happen or not for this year. I guess I can add one other thing that came up during our board conference call just a little bit ago. That was just an idea that I had. It kind of leaps ahead to one of the later topics on virtual programming, but the idea just occurred to me that as we look at putting together virtual programming, then there may be an opportunity to use what we create there to leverage donors, to share some of the virtual programming that we've created, even if we share it with them after the fact, so that we basically put out on social media, check out how camp is staying connected with its campers and families. We had 700 people log into this virtual campfire last night. If you want to help keep camp camping, here is an opportunity for you to fund future projects like this. Send us a $10 donation or whatever. So we're talking about how we can be thoughtful about new ways of offering programming, but that we could also leverage that for fundraising.
Well, as a guy who just got over the fact that 8-tracks and cassettes are no longer around, I'm not really kind of too crazy about virtual stuff, because I don't see how it can even remotely impact kids the way that reality can. And I just don't know if I want to go into it with making virtual camping the new reality, and we all end up like the guys on Wall-E. So I just don't really, want to pursue that too much. But if push comes to shove and the board wants to do it and my programming staff want to do it, then they're going to have to find somebody who can put that together. That's how I feel about the virtual thing. Is like, I got 151 kids and 100 staff. What does virtual camping look like in that arena? So I tried to watch one last night that Give Kids the World was doing, because we're supposed to have one of our wish kids that we send go last week, and she couldn't make it. And it was just an arts and crafts project, and that was a virtual camp. And I'm like, oh, that's just not what I don't know. I'm a dinosaur, so that's all I gotta say.
I think some of the perspective, one of these last night, Dave Smith was talking about a virtual campfire that they posted to Facebook yesterday evening. I think the idea is, for most of the conference calls that I've been on this week, is that you would put together lots of little touches that get scattered out instead of, trying to get everybody to log in and sit in front of a screen for a week as if they're at camp, but that kind of scattered throughout, you would have like, hey, here's a 30-minute campfire thing that you could get together and virtually participate in. Here's a cooking class. Here's a arts and crafts project, different things. So I don't think for anybody they wanting, well, and Chris, you may have some different ideas for what y'all are thinking about doing with your virtual camp. But I think a lot of the ones that I've heard so far are talking about what little things can they do to scatter throughout that basically helps the camp community feel connected with one another, not that it is a full-time and long-term replacement for camp, but just during this weird time that we're all living in would kind of help people feel like they're still part of a community.
Yeah, I'll just add on to Brandon. So, and keep in mind that I'm not the creative person that makes the program fun. So, but things that just my task force and I have talked about this week are, rather than have a week of kids week, a week of teen week, we do kids week. Kids camp for that age group is going to be every Friday from 1 to 2, or every Saturday from 1 to 2, and we block out us like throughout the summer, because we're also looking at we know that parents are basically trapped in their house with their kids right now. Well, I'm making that sound more extreme than it may be in all cases, but they're looking for things to keep their kids entertained. They're looking for things to keep themselves entertained. So as we're talking about it, we're thinking of it more of a, you have something to look forward to over the next, 8 to 12 weeks, when you feel like you've been on social distancing and in your house forever, and you're not thinking about that crisis mode situation anymore. You're thinking about more the long term, and how do you handle that for your family's mental health and for our staff's mental health too, to be honest. I mean, I want to give them something to look forward to as well over this long run that we're in. And I guess the only other thing I would add is we're looking at stuff like, do we offer, and these are the late night, thoughts the last couple of days. Sorry, I touched my face. Do we have some things that we just push out to everyone, like the Facebook campfire programs? And then do we have interactive things where people register and they can interact with the person that's leading the activity? And maybe we do something where we have activity kits that we order and get delivered to people so that they can participate in something and they get the supplies as well.
And I want to just keep going with this arena that we're talking about now, and really look at the contingency plans that folks are, and I do the same thing, Chris. I keep touching my face, but that's me. But I got my sanitizer. Don, you can even go to the next one. We'll just keep going to talk about what folks have in place and what are folks thinking. This is just two graphs. Again, from the pre-survey about, if you can't hold camp this summer, have you developed plans to bring camp to the kids? 57% said no, with the caveat that, the second question is, have you considered or made plans to provide virtual camps or programs and services? And that is a 54% said yes. So I'd like to finish out our town hall really just talking about the contingency plans, or things that folks are thinking about or already have in place. So on the next slide, we're just going to talk a bit about, what is it that folks are working on, whether it be their Facebook page, media posts, videos, virtual items, or camp in a box where you send things to your campers. So what I'll put it out there to what are folks working on? What have you done already? What are you considering? Do you have any questions? You need help with any of these that somebody else may be able to assist with?
This is Crystal with Greater. Honestly, it wasn't until the COCA survey that I was like, oh, virtual camp, what a brilliant idea. Something that we could at least, like you guys are talking about, scatter some things in and maybe bring some sort of camp tradition or something into the home when we don't have the ability to connect in person and one-on-one or two-on-two or whatever the case may be. So we are just starting to look into some of these options and are really excited about it, and definitely think it's something that, these are little things too that we can carry throughout the year and different times to really expand upon the program that we're already offering too. So lots to come, I think, but no solid plans on our end yet.
Yeah, this is Joey. We have 15 in-hospital camps, 4-day camps a year, and that's about as virtual as I've gotten so far. And we try to bring the camp to the kids as much as we can, and I just don't know how we can duplicate that even remotely online. And so I'm looking at these things that we have on the screen, and the reality is we're in a very low economic area for our camps, and don't know how many people will have access to computers. About 30% of our families can't apply online anyway because they don't have a computer or the savvy to get there, which is calling the kettle black, I know, but that's what we have, and so we have to have paper applications come in and put them online for consistency. But I just don't know. 30% of our campers don't have access to computer things, social media, scanning, things like that. So I'm interested in seeing what you guys have, and if you guys have great ideas for low economic families to be virtual, please let me know.
This is Crystal. Sorry.
No, go ahead, Crystal.
Again, we don't have any solid plans, but some of the things we're talking about are this, like the camp in a box, where they don't have to have access to technology, but where maybe we mail them a little small package of a craft activity or something that they can do with their family or their siblings, or even in the hospital potentially, that doesn't cost a lot of money. So like a Twizzler and Cheerio.
Crystal, if you could even email us or even put it in the chat function, because we caught the Twizzler and Cheerio, which makes me very curious. But yeah, any ideas that you can think of, obviously we want to hear your voice, but I know it keeps cutting out on you. But Joey, yeah, I know the same thing with some of my families that technology is an issue. So, we're looking at more of for our camp is a mix of that virtual aspect. If we need to get to that, again, we're in August, so we're holding out. But we're really, yeah, definitely. So we'll get together and we'll figure something out and we'll work it out. Because yeah, we want to make sure, like you said, camp, we'll never be able to. We can acknowledge that we may never be able to truly create the same atmosphere as an on-site camp would be. But if we can still hold true to the feelings that we can create and the bonds that we can hopefully continue, that's my hope, is that if I can continue those things, that's the way I can bring camp to them. But yeah, like I'm looking at the same thing as some folks are saying with how much I can stuff in a box and mail it to them. And then if they are able to log in and do the arts and crafts project with me, kind of a thing, then they'd be able to. But the others at least have the materials to do it together with their family.
I just wanted to share something really quickly that happened while we were on this call. So our camp hosts the Muscular Dystrophy Association for 3 weeks. We host their Pennsylvania, New York, and New Jersey camps. And we just got an email that because their kids are immunosuppressed, MDA has decided to cancel all of its summer camps across America for this year. And that's a I mean, they get millions and millions and millions of dollars for it, so it's a pretty big thing that they're deciding to do.
That's a bummer, but
Yeah,
I
well,
understand.
that is a shame.
One thing I put in the chat box, but just to make note so that people know it's there, another resource, ACA Texoma is doing a kind of virtual town hall like this, and I put a little post about what some of the planned topics are. It's sort of a panel discussion is actually what they're doing, but bringing together some of the local authorities. So the Texas Department of Health is going to be on the call presenting and available for questions, and Oklahoma will be as well. ACA is trying to do that for each of their field offices, and I verified that you do not have to be an ACA member to participate in that. So, you know, the one that I posted is the one that you can sign up specifically for panelists from the Texoma region, but for Chris, for Matt, for people who are in other places, check the ACA website for upcoming webinars and educational events, because they're doing this. They did one in California last week, so that one's already happened, but they're trying to do this sorry, everywhere, and again, it is available to anyone regardless of ACA membership. And I'm moderating one next week, so the Texoma one.
That's the one that we'll all go to then.
It may not apply to New Jersey very well, but anyway.
Any other thoughts or questions, concerns, anything that we may not have covered that folks have a question about that, you know, other members of our call could help with?
I think we should show Joey how to use an iPad.
Yeah, why is that? Nah, I don't have an iPad, so you know I'm a Samsung guy, so yeah.
And get him to get rid of his AOL account.
Never.
Great. So again, there's been a couple of extra things on the chat, in the chat function, but please realize that we are going to, I'll reiterate it because I want to make sure people understand. We are going to, oh, I'm sorry. Has Dr. Amelon had an opinion on this summer that he has shared? Tried to ask, but you're not hearing me. Sorry, Deborah, that we aren't hearing you. I'll be honest, I have not heard from Dr. Mike as of yet. I'm hoping that he'll be on our next town hall meeting because his region will be technically the next one. But again, if he does, and obviously it'll be documented here, those messages will be shared with everyone. So if you have any other questions, on the next slide is just our contact information. Myself, Don, Jennifer, our email addresses, our website, Facebook listservs. If you have other questions regarding anything, in all honesty, please let us know. We're here for you as well. We want to be able to be a resource and a way to connect all of you. After this town hall, we officially end. There is a survey. There's a link that is going to be put up on the next slide, but it is also found on our website. If you could please visit this survey, it shouldn't take you really more than 5 minutes or so to fill out. It's questions about this specific town hall, and if there are topics that you would like to discuss more about, you know, whether it's fundraising or you want to have a town hall on virtual camping or a town hall on staffing or there's a section that says, what other topics you'd like to talk about. These are the first time that COCA has done town hall meetings like this. And we want to make sure that, we're reaching as many folks as possible and we're meeting the needs of our membership. So please, if you don't mind, just hopping on that survey, filling it out for us, let us know what you'd like to see and how we're doing. It would be greatly appreciated. So if there are any other comments, we can end our meeting. Oh, Don loves to put this one up. We got this from Brian. The diagram of Zoom meeting attention span. So we really hope and that, that little red section that says actual meeting content, we're really hoping that it's above 2%, that you actually got more than 2% of us. It's it's pretty funny. It's a good joke. There is a section, I think, about animals, which, no, there isn't. I'm surprised. Oh, the cat and the keyboard. But, it's funny. But